Hello and welcome. You're watching yet another episode of Dotor in the House on Herald TV. Today we're going to be discussing cataract, and with me I have Dr. Chandra Prakash Oli, consultant ophthalmologist at the ASG Eye Hospital in Karanjali. He's done his MBBS from the Goa Medical College and completed his further studies from Hyderabad with a long experience of more than a decade in LASIK surgery. He is in Goa with the ASG Eye Hospital. Doctor, welcome to the show.
Hello, sir.
Getting to the point first, what is cataract? Could you explain to our audience what cataract is actually?
In eye, we have a lens which helps in the focusing the image of any object we see. It passes through the lens of the eye and finally the image is getting focused on the retina. So cataract is basically clouding or opacification of the lens. Okay, so this is the lens of the eye. If you see the eye model, we can see the front part is the cornea, then we have the black part which is known as the iris, and after behind the iris we have a clear structure known as lens, which helps in the focus of the rays which are coming from the object. So in cataract, basically this clear lens starts to become cloudy and opacified, means it starts becoming whitening. So when the cataract develops, finally it becomes like this. So this is cataract and this is a clear natural lens what we have. So in cataract, slowly this different shades of whiteness start. Initially it is less white, over a period of time it becomes more and more dense white, and finally this is the end stage which is known as a total cataract.
Okay, so what are the symptoms of cataract? How does one know that he is having cataract, so to say?
Yeah, so the first important symptoms what we get, usually patient complains with us, is cloudy vision or foggy vision. They will feel as if they are seeing through a frosted glass or a fogged up glass is there, that type of vision will be there. Slowly as the grade of the cataract increases, this foggy vision becomes more and more dense and there is a vision loss. Okay. And this other complaints what the patients usually complain is fading of colors. Then they have difficulty in night driving a car, so whenever the vehicle's light comes from the front, they have difficulty in concentrating or seeing the object. Other symptoms are many people come with frequent change of glasses. So that is also a sign of cataract. People are wearing glasses and they are changing it was never changing and suddenly starts changing very rapidly, because as the lens becomes more and more white, the power of the lens will also change.
Okay.
So that's why there is a frequent change of glasses. And in the end stage, if the cataract is fully complete and dense like this, then he'll only perceive only light. He'll not able to see any object or something, only light perception is this. That is the end stage of the cataract.
Okay. So what are the causes for cataract to happen?
So causes, the most important, most common cause is something known as senile cataract. Senile means age-related cataract.
Okay.
So it is related to aging. So this is not a disease, it's a normal aging process, like how your hair becomes white over the period of time. Slowly the lens of the eye starts becoming white and white. So this is the most common. 90% of cases are age-related cataract. So if you take on an average, by 60 years of age, almost 50% of the people will be having cataract. And by 70, almost 60% of the people will be having cataract by 70 years. Okay. So this is the most common cause. The other causes is traumatic cataract. Traumatic means some injury had happened in the eye, like the ball had hit your eye, or some pencil had gone, or some pen had gone, or some piercing object had hit the eye. That also can cause a cataract. This is known as a traumatic cataract. Other causes are like we have something known as congenital cataract, means the child is born with a cataract. That is usually because the mother is having infection during the pregnancy.
Okay.
A certain infection during the pregnancy can cause of the mother can cause cataract in the child to be born. Okay. And also some genetic conditions or some metabolic conditions can also lead to cataract. So these are one of the common causes of cataract. There are multiple causes, but most common is the senile or age-related cataract.
Okay. So what are the various treatments available, and in that is eye drops, use of eye drops sufficient enough to treat cataract?
No. So the treatment of cataract, one should know very clearly, is only surgery.
Okay.
No drops, no tablet, no injection, nothing can cure cataract. As I've told you, it's not a disease, it's an age-related process. So you can't stop aging. Similarly, you can't treat a cataract with drops, injection or tablet. The only treatment is we have to remove this cataractous lens and replace with a artificial lens. So what will happen? We will remove this cataract and we'll put a artificial lens inside the eye, and this will function like a lens for the focus of the object. So treatment is only surgery and replacement with a lens.
Okay. So in the surgery, what is the exact thing that happens?
Yeah.
How is the surgery performed?
So the cataract surgery has been evolving over many decades and many years. Okay. So the modern day cataract surgery is known as phacoemulsification, commonly known as laser surgery. You must have heard of laser surgery. We are doing laser surgery. So phacoemulsification surgery, or commonly known as laser surgery, it involves giving a small cut on the eye. Like we give a 2 millimeter cut. Small cut on the 2 millimeter cut we give. We melt the cataract inside your eye.
Okay.
We melt it inside your eye and then suck it out.
All right. So when you say you melt the cataract,
yeah, we have a special device which is known as a phacoemulsification probe, which goes through that 2 millimeter incision.
Okay.
It will be directed to the cataract. It will has a ultrasonic energy. It emulsifies, means it liquefies the cataract, hard cataract.
Okay.
And then through a vacuum, in the same machine there is a vacuum, through the vacuum it is sucked out.
Okay.
And after that, we put a foldable lens inside the eye. So we have made only 2 millimeter incision. Through the same 2 millimeter incision by which we remove the cataract, we put an artificial foldable lens which goes inside and opens up and takes the place of the cataract.
Okay.
So that is the modern day cataract surgery doing as phacoemulsification, also known as micro incision cataract surgery. So this is what we usually do in the cataract surgery. In the olden days, it was different. There was a manual surgery.
Yeah.
We used to make a big cut. So this cut was around 6 to 7 millimeter. Then we used to go inside the eye using special device, hold the cataract manually, and then remove it. So it was a manual technique, also known as manual SICS technique. So that is no longer practiced. The modern day cataract surgery are with a small incision, and it can be done very easily and very fast.
Full of precision.
Yes, full of precision.
So how long does the surgery take? And I mean, since you said it is just 2 millimeters, is it painful then?
No. So as I told you, we make a very small incision. So we don't give any injection also. Okay. So the numbing of the eyes is done by numbing drops. In the olden days, we used to give injection on the eye, beside the eye, to numb the eye, and then we used to do surgery. But nowadays what we do, we put a numbing drops in the eye of the patient. With that, the eye gets numb. Then through a small incision, we make a cut and then remove the cataract. And through the same thing, we put a lens inside the eye. So it is quite what you call painless, precise. There is no need for any injection, no need for any patch after the surgery. And
yeah, that is what I was going to ask you, because earlier whenever somebody spoke about cataract, it is always the first thing you notice about someone having a cataract would be a patch on the eye.
Yeah, that patch was because we used to numb your eyes, and your eyes was not able to function for at least 2 to 3 hours. So you can't keep your eyes open with a numbed eye. But here we don't put any injection, so it is painless, stitchless, patchless, and you don't require to get admitted also. You can go same day home.
So you don't need to get admitted.
Yes.
I was going to ask you whether in a cataract operation do you need to get admitted?
No,
because
cataract is a daycare surgery. Daycare means come on a day, go at a day.
Okay.
So it is like hardly the time of the surgery. You can say if I tell about the surgery takes 15 to 20 minutes. And after 15 to 20 minutes, we'll shift to the ward. Till then the discharge formalities, everything will be done, and you can go home. That is how it happens.
Okay. We have our viewers' questions coming in, and there are these 2 viewers who have almost similar questions. We'll first listen into Neha. She's got a question for you.
Yeah.
Hi doctor, I'm Neha, and I wanted to know that when people are diagnosed with cataract, how early should they get the operation done? And how long can you stay with cataract?
And the second question is from Rita.
Hi
it's almost a
doctor,
similar
my
question.
name is Rita. My question to you is, how long can you stay with cataract?
Yeah. So now the concept of timing of the cataract surgery has changed drastically.
Okay.
And that is because of the type of surgery we are doing it, the modern technique surgery. Now the patient decides when to do the surgery. The concept of mature, immature, ripe, unripe, that was more for a manual surgery. Because something which is ripe, you can hold it manually and remove it. Something which is unripe, it will break inside the eye. So that concept was more true for the older cataract, which we are doing by a manual technique. But modern day cataract surgery, the concept is very simple. When the cataract is affecting your vision, And when the cataract is causing difficulty in your day-to-day activities, you are not able to do certain activities which you are able to do previously because of cataract, your vision is getting blurred, there is a time to get operated. So that patient will tell, see, I was able to do all these activities, but now I am not able to do the activities. So that's the right time to do the surgeries when the patient is finding difficulty with the cataract.
So basically, it's the patient's vision issues which will determine when the operation should be done.
That ripe, unripe, this no longer holds true with the modern day cataract surgery.
Okay. And within the operation, within the surgery, does a patient have options?
Yeah. So I've told you, we put a lens. So we remove the cataract one step, and second step we put a lens inside the eye.
Yeah.
So what type of lens you put will be determined what is the visual requirement after the surgery. So we have basically three types of lenses. One is the monofocal lens. Mono means one focus. So in monofocal lens, patient will have a good distance vision, but he'll require a reading glasses after the surgery.
Okay.
Then we have something known as multifocal lenses, in which we have the bifocal and trifocal lenses. Bi means two. So the patient will have good distance and near vision after we put this lens. And the third important is the most recent lens is the trifocal lens. Trifocal means three focus. Distance, near, and something called as intermediate. Intermediate distance comes under laptop distance, or you are doing makeup for females, or combing hair, or dashboard vision. This comes under intermediate vision. So nowadays the modern lenses what we put inside the eye are trifocal lenses, and it takes care of all the distance focus, distance, near, and intermediate distance focus, and patient can enjoy spectacle free vision after putting such lens in the cataract surgery.
So how is this determined as to what kind of lens one should go for?
Yeah, so that depends on what is the status of the eye first. Like if there are certain other diseases in the eye, then we can't go for, like he has a glaucoma problem, or he has a something retina problem, then we can't go for a multifocal or trifocal lenses. Then we have to implant the monofocal lenses. But all depends on how much the patient is motivated to wear glasses or not to wear glasses. If he is comfortable wearing glasses, he can go for a monofocal lens. But he is very much motivated that I don't want to wear glasses after the cataract surgery. For them, the best lenses are the trifocal or the bifocal lenses, which are also known as multifocal lenses.
Multifocal lens. So basically, it's to do with the individual choice.
Yes.
What kind of surgery, as well as
what type of lens.
What type of lens.
Yeah.
These both are determined by the patient.
We explain the patient of all the pros and cons, and we check the eye whether he is fit for the multifocal or lens. If he is open, we have options of all the lenses for the patient. Then patient has to decide and tell us what lens he feels is best for him, according to his visual requirement.
Okay. So on that note, doctor, we will take a short break, and on the other side of the break, we will come back to you with more discussion and a lot more questions from the audience, again related to cataract. Please don't go away. Keep watching Herald TV. Welcome back. You are watching Herald TV, and this is your show Dotor in the House. Today we are discussing cataract. With us we have Dr. Chandra Prakash Oli. He is a consultant ophthalmologist at the ASG Eye Hospital at Karanzale. Doctor, we have so far discussed the types of surgeries that are possible and the causes of cataract. After the surgery, when can one get back to their normal routine and start working their daily schedules?
Yeah. So after the cataract surgery, the vision is quite good immediately. Okay. But a certain precaution and certain restriction you have to follow. Okay. So the what we tell is that no smoke, no dust, no water, nothing should go in the eye. Okay. And this restriction are usually for a week. After 1 week, whatever you are doing before the surgery, all the activities you can do. So activities which are to be avoided immediately after surgery is taking head bath. Okay, you can't take a head bath. You have to take below the neck bath because water can go. You can't wash your face. Okay. Then
so when you say immediately, for how long is this?
For a week.
For a week.
All these restrictions are only for 1 week.
Okay.
Okay. No head bath for a week. Then no washing your face. Okay. No going in kitchen because that vapors may go and irritate your eye. No going outside because any dust, smoke may go. You have to be preferably inside the house. Okay, that is important. And you have to wear dark glasses for a week. That is because initially you will feel a very increased light sensitivity, and it may irritate your eyes and watering, everything may happen. So for that we give dark glasses, which have to be worn for only 1 week. So 1 week is the time for restriction of, like, you are able to see, but avoid all those things like water, dust, smoking going in the eye. And after 1 week you can do whatever activities you are doing previously like a normal person.
So you can get back to your activities, but then you have restrictions on whatever activities you are doing.
Yes. So preferably we say that wait for 1 week. Then if you want to go to the office, you can go after 1 week, because when you go on office, you tend to, something may hit your eye, something may go in your eye. So we tell the patient to be inside the house and be protected for a week.
Okay.
Although his vision is very good immediately, but still we tell them to be very like say on the safer side, to be
external protections.
Yes.
Okay. So we have another audience, a viewer who has sent in a question. Let's listen to that.
Hi, my name is Sonia, and my question was, what are the risks of cataract surgery?
Okay. So
very simple, straight question.
Yeah. See, modern day cataracts, as I've told you, this older generation technique, the risk was very high. But as refinement has occurred, the risks are very minimal, or you can say very less. It is 0.001%, like that.
Oh.
That risks are very minimal. Nowadays, it is, I've told you, it is precise, painless, everything, and you can immediately do see clearly, and within a week you can do all the activities. So complications are very minimal nowadays.
But yet we find people having a kind of a resistance towards getting into surgery because
that was initially, say, I've told you, manual surgery, people used to wait for 1 month. They used to not have a bath for 1 month. They used to not have any food restriction, no eating non-veg, all those things were there. But that doesn't hold true now, because that was a big surgery, recovery was slow. Modern day surgery, recovery is very fast. So people should be aware that quite now the cataract surgery is very safe, and it's a daycare surgery. You have to get operated and immediately can go home. So the chances of complications are very, very minimal.
Okay. We have a viewer, Annie Fernandez. She has sent in a question for us.
Yeah.
Hi, this is Annie Fernandez from Naveli Mia. I want to ask a question to a doctor. What precautions have to be taken after eye surgery?
Yeah.
And if there is discharge from the eyes, what has to be done?
So one of the questions I've already answered. What are the restrictions? Same thing. No water, no dust, no smoke. Nothing should go in the eye for a week. No taking head bath for a week. No applying makeup for a week in case of females. And no, some people ask whether the oil can be put in the eye. So 1 week we tell not to do anything. After 1 week you can do everything. The most important question what she had asked, what if discharge comes from the eye? So 3-4 signs we have to be very careful. One is if there is a redness in the eye.
Okay.
If there is a discharge coming in the eye. If there is a pain in the eye, we have to immediately report to the concerned doctor in the hospital immediately, because this may indicate some infection problem may happen. So whenever you have a discharge, or you have a pain which is unbearable, or you have a redness in the eye which has increased, then you have to immediately contact the hospital and the doctor, and we have to get it checked whether any infection is there or not.
So normally the thing is, maybe it is because I need to use some eye drops or something like that. So do not fall.
No, do not. You have to immediately come and contact and show the doctor. If you have a discharge, redness, you can't be judging what is the problem and putting drops and feel that it will go. No. Sometimes the infection is there, then you have to treat it very early. Only doctor can examine and tell whether any problem is there. Once you get an opinion of the doctor and he says that everything is fine, then you can be relaxed. Till then you have to contact the hospital and doctor immediately.
So as you said, I mean, the percentage of the risk involved, and for that matter with regard to infection, is very minimal, but then there is a possibility.
0.01%. So it is less than 1%.
Okay.
So rarely happens, but these are important signs. What she has asked also, discharge, redness, pain, you have to immediately report, and if the doctor feels, he will tell you the problem, what is the problem.
Okay. And how long does it take to recover post-surgery? I mean, if these if problems are not there.
Talk about healing, healing takes 4 to 6 weeks.
Okay.
4 to 6 weeks after surgery. Vision, immediately it is clear. Okay. 90% of the healing will take in first week. Okay. So after first week, you can do all the activities. But by 4 to 6 weeks, complete healing of the surgery happens. So total recovery is 4 to 6 weeks after the cataract surgery.
We have a viewer, Fabriana, and she's got a question for you.
Hello doctor, I am Febronia from MAPSA. I want to know how long does it take the eye to heal after cataract surgery?
Yeah, as I have told you, 90% healings will take place within a week, and remaining 10% will take place in 3 to 4 weeks.
Okay. And normally this is one very important question, though not in the adults, but not in senior citizens very specifically, but people who below the age of 60, is that can cataract surgery eliminate the need for glasses?
Yeah. So cataract surgery, I have told you, the whether to wear not glasses or not to wear glasses will depend on what type of lens you put inside the eye. So modern day newer generation lenses, which are the multifocal lenses, will reduces the spectacle dependency. Like if you put those multifocal or a trifocal lenses, you don't require to wear glasses. Traditional lenses, which are the monofocal lenses, if you put those lenses, you'll require glasses for reading fine prints. If you put a newer generation of lenses like multifocal and trifocal, you will not require glasses for reading and also for distance.
Okay. So, and again, that would depend on, one is on your choice and also on the health of your eyes.
Yes. So both, and third important thing is the budget also.
Yes.
Because the newer generation lenses are a little more expensive compared to monofocal lenses. Okay. So we'll check your eyes and see whether you are fit for multifocal lenses. Then we'll see what is your visual requirement, and finally the finances.
Okay. And before I ask you the next question, we have a viewer, Russell. He's got a question for you.
Hi doctor, my name is Russell. I just wanted to ask you a question. Why these days cataract are found in young adults? So what are the reasons for the same?
Yeah. So cataract in young, the most common causes nowadays are because of diabetes. So diabetes is one disease which causes cataract in a decade earlier. Like suppose you are supposed to get in 50, you will get in 40 or even 30 also. Okay. Because uncontrolled diabetes itself hampers the nutrition of the lens, and the lens starts to become white faster. So one most common cause in younger these days are uncontrolled diabetes. Other factors which are seen like smoking, uncontrolled hypertension, or if you have a family history of cataract, or if you are taking steroids for a very long period of time for any disease, like for other diseases in the body, you are taking steroids and you have been taking for a long period of time, that also can cause cataract. So these are some of the common causes of cataract in the younger age group: diabetes, uncontrolled BP, steroid intake. Then if you have an injury in the past, that can also cause cataract. So these are some of the common causes which can cause cataract in the earlier age group, in the younger age group.
So one should avoid hitting each other on the eyes.
Yes. In any form of injury.
In any form of injury. But as you said about diabetes, because now diabetes, mostly it is hereditary, and people whose parents or grandparents have had diabetes, they are prone to diabetes at an early age group. So what could be the precautions? Is there, are there any precautions that one can take to avoid getting cataract?
So all this diabetes, hypertension, these are a lifestyle disease.
Correct.
Which was not there previously in the older decade. That is because of sedentary lifestyle, like the metabolism of the sugar doesn't take place. So what you have to do in people who are having diabetes, they should check their eyes regularly, every year, because diabetes affects two important structures in the eye. One is the lens and other is the retina. In the retina, it will cause bleeding in the eye. The vessels get weak and they start bleeding. So any people who have diabetes or have family history of diabetes, they should check their blood sugar and also check their eye.
Nice.
Because sometimes people don't know about their diabetes, and from the eye they come to know that they have diabetes. Like we see some retina bleeding, we tell them to check your sugar, and that time he finds that he has a diabetes. So checking the eye also can sometimes point to diabetes. That is also necessary.
And so why you get your cataract operated, is there possibility that you get cataract again after you're doing a surgery?
No. So what the most common confusion people also have is they feel that you can get cataract again after doing cataract surgery.
Yes.
So there is nothing like that. Once we remove the cataract, we remove the whole of the lens outside. So there is no part of the lens which is there inside to develop cataract. There is a thin membrane wherein we put the lens. So the only remnant which is left behind of your natural lens is a thin membrane, which is like a fine sheet, like you can say, like a transparent sheet of what do you call, plastic. So that membrane is left on which we put the lens. So this cataract will never develop again because we have removed all the cataract. Only what can occur is something known as after cataract. After cataract is not a cataract.
Okay.
This thin membrane which was there on which we have put the artificial lens, it slowly starts to get thickened. It becomes thick. Because it becomes thick, little vision can go down. So that is also commonly in medical terminology we call it as PCO, posterior capsule opacification. So it is not a cataract as
So it's
such.
not cataract, but
It's just a membrane which has become thinned. And the treatment of this is very simple. There is a special laser. You have to just sit in front of the machine. Hardly it takes 2 to 5 minutes. We just clean that membrane which is there, which is behind your lens.
Okay.
So that is the thing which can occur, which will also has drastically reduced now, because the new lenses, they don't allow this membrane to become thickened. So
Okay.
previously in older lenses what we used to put, we used to see high incidence of this PCO, what you call the posterior capsule opacification. Nowadays we don't see it, and even if it is there, we can treat it like with a laser only we can treat. Hardly it take 5 to 10 minutes.
Okay. We have a viewer, Prakash Naik. He's got a question for you.
Yeah.
Hi doctor, this is Prakash Naik. I had a question for you. Can cataract surgery be performed on both the eyes at one go?
Yeah. So cataract surgery is not usually advised to be performed simultaneously. What we do is a sequential cataract surgery. Sequential means one eye at a time. Like the earliest we usually recommend is, like suppose we operate a right eye, wait for at least 1 week, let that eye heal, and then go for the second eye. Okay. Simultaneously, bilateral cataract surgery is not recommended. Only recommended in special situation, like the patient is little having some skeletal abnormalities wherein he can't come again and again, or he has some what do you call, mental retardation patient, wherein we have to give the general anesthesia once, and on the same sitting we have to do both the eyes. Otherwise it is not recommended to do simultaneously bilateral cataract surgery. What is recommended is always sequential surgery.
So the cataract in the eyes will develop simultaneously in both the eyes.
Yeah.
But the operation would be done
One eye.
sequentially.
Yeah, so one eye which is affected more. So usually the cataract is always seen one eye more compared
Okay.
to the other eye.
Okay.
Other eye may not have also.
Okay.
Some usually seen in both the eyes with one eye more or only in one eye. So whichever eye is affected more, that is whichever eye has a less vision, we have to operate it first.
Okay.
And then we can go for the second eye.
So lastly, doctor, since we have been, and this whole process involves the most important part of your eye, and that is the lens, where you're saying you replace the lens and only a membrane is left behind, and on that you place the artificial lens. So now, what is the life of this lens that you put during cataract?
So this also is a very common question. People ask like, doctor, we are putting the lens, how long the lens will stay in the eye?
Yes.
And secondly, whether we have to change the lens again and again.
True.
So it is not like a spectacle. Okay. See, we have to change it every year, like that. Lens nowadays, whatever lens are there is for lifetime. Once you put it, it will be till the life. You don't have to change it. You don't have to exchange it. Nothing. After the cataract, during the cataract surgery, we remove the cataract and we put the lens. And this lens is once in a lifetime. You have to put it only once, and the life shell is still whole life.
Whole life. So it's not that, because your vision probably, as you said, if you're using a monofocal lens, then you might have to increase or decrease your glasses, the number of your glass, but not the lens.
Yeah. There is an option of that also.
Okay.
People in older generation, whether they have put a monofocal lens, and now they want a multifocal lens, they will ask, doctor, what to do?
Okay.
I didn't know about the multifocal lens then. That option is there. Only in such situation we can do it.
Okay.
That too, we will see the safety first, whether the lens is free to be removed or not. Many times the lens get entangled and we can't remove the lens.
Okay.
So if it is possible to remove and you want to exchange with a multifocal lens, we can remove and put a multifocal lens. But these are only in special situation, not in all the cases. 99% we don't remove the lens. It is permanent.
But a patient can come to you and
Yeah.
ask you whether it's possible or not.
Yes, yes, yes.
Okay, so those were the questions with regard to cataract. If you still have questions, queries with regard to cataract and they have not been answered today in today's show, please get in touch with Dr. Chandraprakash Oli at the ASJ Eye Hospital in Karanjali. And for all your cataract needs, you can always visit the ASJ Eye Hospital located in Karanjali. And for our viewers, keep watching Herald TV. The episode is always on telecast on Sundays at 11 a.m. and for your repeat viewing, it's available on all our social media platforms. So keep watching Herald TV, not just Dotor in the House, but other programs too. Thank you for watching Herald TV. Take care, keep safe until we see you again.